Isolate. First, we need to rinse the injury part. So next, take cotton wool to clean the injury part. We gonna put some ice to control the bleeding and reduce the swelling of the injury part. So it's gonna take in 10 to 15 minutes for every session. So next, we're gonna clean the injury part with cotton wool. And next, cover the injury wound with some bandage. Lower the cover and lower and higher the cover from the injury part. After finish cover the injury part, we may elevate the injury part. Use some bench chair or something others like pillow or something on. So this is only the early injury prevention. So if necessary, go to clinic or hospital and meet the doctor. Thank you.
Okay, now I will present about the heat exhaustion. Okay, the heat exhaustion meaning is it caused by loss of salt and water from body. Okay, this heat exhaustion is commonly through excessive sweating. Okay, next I will present about the sign or symptom of this heat exhaustion. Okay, now I can get the 4 symptoms that I can list. Okay, the first one is headache, and the second one is dizziness. The third one is feeling sick, and the last one is sweating with pale and clammy skin. Okay, now I have a question. What need we do if someone get the heat exhaustion? Okay, now I will solve the problem. Okay, and the first thing that we need to do is get them to the cold place. Then the next step is lie them down with leg raised. And the last step is we need to do is give them water or isotonic drink.
Where are the place that you feel? Oh, just relax. I can talk. Okay, now you will drink a lot of water. Okay, what do you feel? Are you okay?
Assalamualaikum warahmatullahi wabarakatuh. Today I will present about Achilles tendonitis.
show me where you got injured?
This is
Okay. Now you stay carefully. I will take you to safe place. Okay. Okay, now we take the victim in a safe place and a comfortable place. Okay, now we use EAB, which is an elastic adhesive bandage. So I'm going to start above the tendon with an anchor and go around once or twice there to make sure you have got good film. Support you come down around the heel, not want to figure out how much movement as the victim have when they start to feel a little bit of stress challenge with the tendons. I want to give them a pretty good range of motion here so I can figure that out. Victim, I'm going to go for there, so I'm going to form an X here across the back of the lower leg under the field and around each time, and can apply 3 or 4 doses depending on how much support the victim likes, and once you are happy that you are enough and they feel comfortable that is giving them enough support but it's not too restrictive, you can just do a little bit of a spiral still using your EAB. You know, 1 or 2 is not harm, just to make sure everything is support and that's not going to come loose. Once you are happy you are enough. Make sure everything stay a mess, okay? Now I check my victim to if get them going around, check to the fleet supportive enough, doesn't not feel too tight, doesn't it feel comfortable is the main thing, okay?
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Syafiq bin Azman from SR134C. Okay, today I will do a injury management about ankle sprain, and the treatment that I will apply is rest, ice, compression, elevation. Okay, now we continue to the role play. Are you okay, friend? Which area do you feel pain? This area?
yes.
Okay. Can I look at it? Oh, your ankle is swelling right now. I suspect that you have an ankle sprain. It's an injury. It's a ligament stretch or torn. Okay. The treatment that I can apply is rest, ice, compression and elevation. Firstly, rest. Okay, avoid any activities that can cause your ankle pain. Secondly, I will apply the ice to this area for 15 to 20 minutes and repeat every 2 or 3 hours. After that, I need to do a compression to help to stop the swelling. I'm using an elastic band, elastic bandage. Okay, now you need to do an elevation to reduce swelling. So elevate ankle above the head, so the gravity helps your swelling by draining excess fluid. You do this in night time.
Are you okay? Where is your pain? Oh, hamstring strain. Okay. Follow me. Slowly. Sit here. Wait for me. Okay, I'm sorry. I need to do some treatment on you. So I will do RICE treatment. So the first one is R. R is for rest. You need to rest your leg for a while and reduce or stop your activity. And then is I. I is for eyes. I will apply this ice on your hamstring for 20 to 30 minutes every 3 to 4 hours for 2 to 3 days. This will reduce your pain and swelling. And then for C, we compress your leg with this elastic bandage. This will help you to reduce swelling. The last one is E. E means elevate. I will elevate your leg on the pillow. is need to be above the level of the heart. After this treatment, you will get more better. Are you good?
What is this then? I'm sorry, ma'am, but you're having a nosebleed, so I'm going to put this in your nose. Please hold it. Alright, so please lean forward because I don't want your blood to be swallowed again and enter to your lungs. You good? Are you hurt anywhere? No, okay. So I'm going to give you a quick assessment. So your circulation is good since it's refilled within 2 seconds. Alright, now I'm gonna. Can you lean forward? Yes, thank you. So I'm gonna fish your nose. Alright, your bleeding already stopped. You need to breathe from your mouth. So I'm not going to pinch your nose anymore because I don't want it to continue bleeding. So it's good because it already stopped. So I don't have to activate the EMS. Okay, you're good? Thank you.